Welcome. We hope this broadcast finds you healthy and safe. Thank you for tuning in to MSK's video pop-up series, where we discuss late-breaking news and issues that affect your business during these uncertain times. Today, we'll be hearing from Jeremy Mittman, partner in MSK's Labor and Employment Department, as well as a member of MSK's COVID response team. As companies prepare to reopen, there are mounting questions on a wide range of topics. And today, Jeremy will be specifically addressing how employers can effectively implement workplace screening and testing. Now, over to you, Jeremy.
Thanks, Doug, and good afternoon, everybody. So, as Doug mentioned, we're going to be discussing today in brief and in a non-technical manner how and to what extent you can perform workplace screening and testing of employees involving COVID-19. I think that really involves four main areas. The question about whether you can ask employees about any symptoms that they have concerning COVID-19, whether an employer is allowed to temperature check all of its employees, for example, every day upon entering the workplace. And a third area would be whether an employer is allowed to do COVID-19 testing on employees and require that as a condition to coming back to the workplace. And then item 4 in terms of testing would be antibody testing. Is that something that employers are allowed to require now? So we're going to talk about all of those in brief. First area is symptom screening. Is an employer allowed to ask employees about any symptoms they may have concerning coronavirus? The answer is a clear yes. Employers are allowed to do that. And that may take some getting used to, because I think we've all been used to a prior regime where we shouldn't inquire into any medical condition concerning an employee. But different times call for different measures. And so it is clear that an employer is allowed to ask an employee regarding any symptoms they may have. For instance, on a daily basis, an employer would be allowed to ask an employee, do you currently have any of the symptoms that the CDC has stated are symptoms? And that is a changing list. For example, that list was amended a few weeks ago to add more symptoms as the medical profession comes to learn more about the virus. So, for example, you can ask an employee, have they experienced any cough, shortness of breath, or difficulty breathing? Do they have a fever? Do they have chills, muscle pain, sore throat, a recent loss of taste or smell? These are all permissible areas of inquiry for employees. Perhaps an enterprising app developer can think of an app and where an employee would be required to input a yes or no to any of those on a daily basis. Or if you want to go for a little more low tech, fill out a piece of paper or respond via email. Any way that you can think of would be permissible. Other types of questions that you could screen an employee about would be whether they've been in close contact with anyone who's exhibited symptoms of COVID-19, whether they've been in close contact with anybody who's exhibited symptoms or tested positive for COVID-19. You can ask about travel as well. Has anybody engaged in any international travel or been to an area that the State Department has decreed to be a level 2, 3, or 4 travel advisory warning? And if the answer to any of these questions is yes, an employer is allowed to restrict employees from coming into the workplace. They have that ability. Okay, let's move on to temperature testing. Can an employer require employees to submit to, for example, daily temperature testing upon entry to the workplace? The answer here is also yes. An employer can do this. The EOC has said that this is permissible given the current state of affairs. There is somewhat of a debate as to whether the California Consumer Privacy Act applies if you're going to be testing employees in this regard. But the simple answer is that even if it does or doesn't, it is not burdensome to comply, and it would be a best practice to do so anyway, which is simply to provide a notice to employees of what you're doing, your temperature testing. What is the purpose? What are we using it for? And are we going to store it or not? These are simply the types of notice obligations or best practices that you should be transmitting to employees in whatever shape or form, whether it's a notice that you're posting at the point of collection, whether it's by email. These are ways to inform employees of what the purpose is. Question about whether you're going to store the data. Think about that. You're allowed to record the employee's temperature and store it. If you do, you have to keep it confidential. It would be equivalent to confidential medical information that should be segregated and kept in separate files than a personnel file. But really, what does it really do for you to collect John Smith's temperature and have a record of it for the past 90 days? So I'm not sure whether that's really necessary, although you could do that. At the point of collection, you should make sure that there is appropriate physical or social distancing so that employees are spaced apart so people aren't crowding up to get a test. There should be sufficient space apart for the employee who's getting the test. Obviously, the laser type of temperature guns that they have would be most effective in this regard. You should consider who's going to be doing the testing. Someone needs to be designated to do so, and they should be trained in terms of best practices on how to do that. Consider whether the person testing should have also greater PPE, personal protective equipment. For example, a clear face shield would seem to me a prudent type of equipment to provide an employee who's giving the test. For example, if anybody were to cough on that individual. So another point to consider really is what is a fever? When are you going to decide to bar someone from the workplace? By the way, you could also test a visitor as well. I'll also mention any third party. The CDC has said that 100.4 is really the definition of a fever. Although some employers have said, well, we're just going to keep it an even number and say 100 degrees. But really keep in mind that temperature testing is not really a panacea here. There are some reliability issues. For example, an employee may be running to work around the block and may have an elevated temperature as a result, so that could be a false positive. Also consider the fact that someone may be infected with the virus and asymptomatic, or just simply doesn't have a fever, but who could infect others. So just keep in mind its utility. By the way, another question would be, what if an employee refuses to get tested in this regard, refuses a temperature test? Well, you're able to prevent that employee from coming to the workplace. That is a reasonable requirement that the EOC has said is permissible, and so you're within your rights to essentially bar them from the workplace or otherwise discipline them if they refuse. Okay, let's move on to our third form of testing, which is COVID-19 testing. Are you allowed to require that your employees get tested for coronavirus? The answer is, again, yes. The EOC came out with much needed and anticipated guidance, and this was back on April 23rd, I believe, where they said that you can. And without getting into all the details, they basically said that under the ADA, the Americans with Disabilities Act, a mandatory medical test can be present if the test is job-related and consistent with business necessity. And I won't get into all the factors, but they basically concluded that a COVID-19 test was. Keep in mind, however, that it is of limited utility, because unless you're requiring frequent testing, it's really just a snapshot in time. You could require that all your employees get a COVID-19 test on the first day of work, for example, but all that would really show is that at that point in time, everybody was negative. Keep in mind that you're also required to pay for the test, and if you were to do frequent testing, that could be expensive. Or you should at least ensure that the employee is not required to pay for the test. Perhaps insurance might cover it, but likely an employer is gonna. This is a business expense that if the employer is requiring, they should be responsible for under business expense laws, especially in California. Of course, if someone does test positive, you are permitted to require that the employee inform you of that, and that information, of course, must be kept confidential. You are not allowed to convey to other employees that individual's name unless you have their written consent. And I think as a best practice, also inform the employee in writing that there would be no adverse consequences if the employee failed to provide consent. And certainly there would be obligations as well to inform employees without using that person's name, but they may have come into close contact with that individual and engage in some contact tracing, which is a little bit outside the scope of what we're talking about today. Last thing I just wanted to discuss is antibody testing. So we've all heard that antibody testing now exists. Another name for it is serologic testing, but I really would say that it has a limited role at this time for a few reasons. One reason is that it just simply remains unknown whether COVID-19 antibodies are actually protective against future infections, or even how long such immunity would last. We just simply don't know. And so I think that that's a limitation for these types of tests. So really at this time, knowing whether a worker has tested positive for antibodies really shouldn't impact his or her job duties, at least not at this point. Maybe that answer will change. Furthermore, I'll also add that the EEOC has not really come out and said that it is permissible for an employer to require antibody testing, at least at this point. I think one of the concerns is the reliability issue, and that it may be of limited utility at this point. Those are really our four areas of testing. And so I thank everybody for listening. If anybody has any questions about anything that we've discussed, obviously, please feel free to reach out. We'd be happy to chat further with you about it. Okay, back to you, Doug.
Excellent. Thank you, Jeremy. And thank you, everyone, for joining MSK's video pop-up series today. These video sessions are intentionally brief. We're trying to keep them to 10 minutes or less, and therefore without Q&A, and hope you find them useful. So if you would like to ask questions of Jeremy, his information is currently up on the screen, his email address, as well as phone number. In addition, if you need additional guidance from anyone else on other topics from MSK's Reopen Rapid Response team, you can simply email reopen@msk.com. Keep an eye out from us for additional pop-up videos in the coming days and weeks, and more importantly, please continue to remain healthy, remain strong, and remain hopeful. Thank you, and goodbye.